As EMS Week continues, we on Monday delved into the physiology of CPR, intrathoracic pressure regulation, and really challenging ourselves to understand the science of those patients we care for that are the most critically ill. On Tuesday, with our good friends at Laerdal Medical, we launched into the Resuscitation workshop, understanding the performance psychology behind teams, the difference between good leadership and good followership, how to bring out the best in folks to optimize your patient outcomes. And lo and behold, it is already Wednesday of EMS Week 2016, and we have no other than Mike Lauria lecturing to us today on a topic that is very interesting and certainly requires more exploration. Equanimity, Puni, and parachuting, evolving concepts in optimizing resuscitation performance. And I had the pleasure of listening to Mike deliver this talk at CCTMC 2016. That is the Critical Care Transport Medicine Conference that went on this past month in Charlotte, North Carolina, and it was an absolute pleasure. And we do in fact have several additional podcasts that will be brought to you from that conference. But a little bit more about Mike. As I mentioned, he barely requires an introduction amongst the pre-hospital foam community. He is currently deep in his second year of medical school, winding it down, preparing for his Step 1 board exam. And we know him from many places. Of course, he was a PJ in the military, certainly operating in the most austere environment as a rescue paramedic. And at present, he also writes regarding the evidence base of the mind of the resuscitationist, really dialing in to one's inner psychology as we approach not only work on a day-to-day basis, but certainly things that push us to our limits. So without further ado, please hang on for this amazing lecture by Mike Lauria, Equanimity, Puni, and Parachuting, Evolving Concepts in Optimizing Resuscitation Performance.
All right, so good afternoon, both you guys. Thank you very much for coming. For those of you who I haven't had the pleasure of meeting yet, my name is Mike Lauria. By way of background, I was a pararescue in the military for a while. So I did combat, search and rescue, and direct support for different special operations teams. Left the military and got into civilian critical care transport and worked up at Dartmouth Medical Center in New Hampshire for the DART program. And, of course, I'm a glutton for punishment, so I got a crazy idea a little while ago and decided to go back to medical school. So I'm in school full-time right now and working per diem and still flying, which really just keeps me sane. So I'm a huge advocate of free open access medical education. I think it's a fantastic thing for our community. So I encourage you guys to get out your phones and iPads and computers and go ahead and tweet, text, post, whatever, and get this information out there and give me feedback. I love to hear what you guys think. I have no conflict of interest at this point, but as a second year medical student, I will shamelessly promote anything for money, food, or beer. So if you have any opportunities, go ahead and let me know. What this talk is about is psychological skills. I think it's kind of interesting. I'm actually like a physiology super geek, but recently I've become really kind of interested in like how our minds work, how they process things, and how we operate under stress. And this talk is about how I can really train people, teach people different skills to improve their ability to resuscitate patients in the field. Make better clinical decisions, recall people's information, and execute skills, basic skills, relatively quickly and efficiently. It's kind of important. Really, I want you guys to walk out here with three things. First, how other organizations, how other specialties have approached this issue of getting their personnel to function and poise under pressure. Two, why that's important, the negative effects of stress on communication. And three, what I call performance-enhancing psychological skills. I'm going to give you a handful of tools that you can leave here with and go home and apply on your next shift. Alright, so we'll wind the talk back to 2005. So I'm finishing up my undergrad, and I did what any level-headed biochemistry major would do, is I decided to heck with my degree and I'm going to enlist in the military. Really not good, right? Well, it actually worked out pretty well. So I got into the pararescue program, made it through selection, and the rest of the training was like one. So we started out with like 72 guys, and there were 6 of us that finished up. And from there, we went out to our individual units and got kicked out to all these different special operations. And it was amazing. It was truly the greatest honor of my life to work with some of these guys. It was the greatest operational personnel on the face of the planet. And it was kind of cool. And actually, the enduring lesson that I learned from these guys was how they managed to perform in these incredible circumstances. In some of the most dangerous environments you could possibly imagine, some of the most hazardous places on Earth, these guys were able to maintain cool and calm and stay collected when everything was going on, the mission was going sideways, when literally the fog of war was starting to envelop them. These guys were unbelievable. They were able to stay calm, they were able to stay focused, they were able to see this crystal clear path to successfully completing the mission. And that was really, really profound. When I started thinking about it, when I started to analyze how people did it and when people did it, the example that I wanted to talk about, that I wanted to give you, was something we did on a regular basis and provided a lot of practice for honing these skills. And that was parachuting. So you might imagine it's a little bit stressful when you're hurtling to Earth at about 130 miles an hour. If something goes wrong, you have a malfunction, you've got about 20, 30 seconds or so to figure it out, otherwise you're going to be from the pancake. And to complicate matters, it's not like the skydiving video you see on YouTube. You have tons of equipment on it. Body armor, magazines, weapon system. Your medical equipment, 15 to 65 pounds of medical equipment, plus rescue kit to literally jump to jaws of life in my lap. So that sort of limits your mobility, decreases your dexterity, which are things that you want in this situation. And what makes it even more interesting is when you do this for real, it's dark out. It's completely dark. So, yeah, it's a little bit challenging. So you can just imagine yourself on the edge of this ramp, looking down at 11,000 feet of flat. It's a little bit anxiety-provoking. Your heart rate's up there. Did anybody else's heart rate go up when they were showing that video in the last lecture when Sullenberger took off? And he's like, I don't really know. My heart rate went up just listening to that recording. But you've got to perform because Sullenberger had 155 people in the back of that aircraft. In our case, we're standing on the ramp, and somewhere down in that darkness is someone who really needs help. And you've got to get it. So his performance really matters. When I started to talk to people about this, what I realized was they had all these little mind games and tricks to kind of keep themselves calm. They didn't really read the psychology literature about this. They just sort of developed their own little tricks over time to sort of keep themselves nice and calm and focused. And everybody had their own little different tricks. Some people would say mantras, some people would say prayers. Some people would have different behaviors or like routines. Have anybody like that at your program that has like a routine or something they do before they get on the aircraft? I would actually say the pararescue creed to myself. So I would stand there for a couple of seconds and I'd say it in my head. It's my duty as a pararescue to save life and danger. I'll be prepared at all times to perform my assigned duties quickly and efficiently, placing these duties before my personal desires and comforts. These things I do that others may live. And that calmed me down. It brought me focus. It reminded me why I was there and what I was doing, and it helped me get the mission done. So later on, when I started actually looking at some research into it, what I found fascinating was that other guys had kind of figured this out long before us, and in a very academic way had explored this. Very rigorous. Guys like this. So this is Haptic Puni. You've probably never heard of him. And in fact, no one in the U.S. had until the late 1980s. But throughout the 50s and the 60s, this guy was the one that the Russians tapped to help them, dominate into the international athletic field. Very, very interesting. This guy did a lot of research in how athletes prepare prepare to deal with the stress of competition in front of hundreds of thousands of people. And what he did was he developed this philosophy that he called voivaya gotonos, which means the willingness to fight, to compete, to persevere, and to win in competition. And his philosophy had essentially 5 pillars. The first was developing sensible self-confidence, not overestimating your abilities, but not selling yourself short or questioning what you're really capable of. Also, uncompromising effort, which sounds pretty reasonable. Numbers 3 and number 4 are particularly interesting to me. So, optimal emotional arousal and developing a high tolerance for stress and distraction. And finally, number 5 was self-control. This was more of an overt control, not freaking out when you didn't get your way, or the ref didn't call things your way, or you were losing the game. So, what he did was he took these 5 things and he built a systematic approach to training athletes. This was really the inception of sports psychology. He called it the psychological preparation for competition. This was the finishing school. This was the finishing touches, the icing on the cake for the athletes to make sure that their skills were squared away in training, but mentally they could deal with competition. And you know what? I really think there's something to that. In addition to training as scientists and clinicians, perhaps we should also spend at least a little bit of effort training our minds as if we were resusc athletes, preparing ourselves to deal with that stress. Not just passively by going through simulation, but actively by learning skills for mitigating that. So I know what you're saying now. Alright. So we talked about military stuff, and we're talking about crazy Western psychologists, but what the hell does that have to do with crisis? And has anybody even thought about it? And the answer, interestingly enough, is yes. Before anybody else was. In fact, some famous people, like this guy, thought of it. This is William Osler. This is by many people considered to be the father of modern medical education. If you go to medical school, you're slapped in the face left and right with essentially everything this guy ever said. Okay? And he's very famous for his ideas of how we train physicians. In other words, he was the guy who said, you don't learn about disease in a textbook. You learn about disease by going into a hospital and working with sick people. And that's become very popular. However, what's less popular and less well-known are some of his other ideas. For example, this one. So in 1885, Osler gives an address at the University of Pennsylvania Commencement Ceremony. And the title of the address is Equanimity, which means equanimity. The definition of equanimity is balance or even mind in times of great turmoil or stress. And in his address, he talks about it, and he says, what we need to develop in people is imperturbability, the ability to not be perturbed by circumstances around you. And he talked about this very specifically. He said, this was coolness and presence of mind under all circumstances, calmness amid storm, clearness of judgment in moments of great peril. He was very clear and says that this was indispensable for any, quote, physician or surgeon. And I would extend that to PA, nurse practitioner, paramedic, nurse, etc. So, it's important when you're jumping out of the aircraft. It's important when you're competing in the Olympics. Daniel-san totally understood it's important in martial arts. It's important in the boardroom when you're trying to make a multi-million-dollar sales pitch. It's important when you're up here giving a talk in front of a whole bunch of people. And I would submit to you it's important when you're in the back of an aircraft at 2 o'clock in the morning and your patient is trying to crumble. Very important. So why should we consider this? Why should we consider developing tools to help people deal with this situation? Well, it's because normally when we train people, when we evaluate people, it's like tests, right? Or you're doing like a skills station and you're getting checked off, right? But as you guys all know, there's a huge gap between that environment and the environment that you do, which is fraught with all this stimuli that create this stress response. And we know, time and time again, this has been researched, and time again, the evidence is very consistent, that acute stress causes your performance to deteriorate. I'm sure you guys have all been here, right? You're really worried about something. Like in the last lecture, you're talking about you lose a little bit of your situational awareness. Sometimes you forget things. You actually don't pick up on subtle cues. Your cognitive bandwidth begins to shrink. And for those reasons, it's really important, I think, that we address this.
Hey friends, I'm going to take a brief moment to pause the show and bring you a word from our sponsors. No, not the sponsors you may traditionally think of, but rather sponsors that are aimed to help eliminate healthcare disparities. This is a very special project I'd like to announce during EMS week for folks to trial. It comes at absolutely no cost and is ultimately designed to optimize your training experience and help translate into improved outcomes within your community in relation to out-of-hospital cardiac arrest. Recently, a group of colleagues of mine and I had the pleasure of coming together and reviewing the science and literature on feedback in CPR, and the data pretty much speaks for itself. Dr. Bobrow, the state EMS medical director of Arizona, has done tremendous work on this, and we now know that all the major defibrillator companies come with some sort of active CPR feedback. Nevertheless, we are acutely aware that once you know a single EMS system, you know a single EMS system, and budgetary constraints are real-world problems and challenges. Not everyone can afford the defibrillator component to their device. So what have we done is designed a watch app for the Apple Watch called Perfect CPR. Now, we should be very important to state this is designed for training purposes only, but nevertheless, once a provider opens up the app using the accelerometer and gyrometer built into the Apple Watch, you will be able to get direct feedback on your rate, depth of compression, as well as recoil. So please check this app out. It is available at $0 in the Apple Watch iTunes Store, and it's called Perfect CPR. Please also find us and follow us on Twitter at Perfect CPR. Again, we're beta testing for this, very excited to launch during EMS week at a cost of $0 and would love your feedback. We can all do a part to help improve the health disparities within our country, and feedback is definitely a requisite component to that. Check us out.
So one of the most popular perturbations of this research was done by a guy named Dave Grossman. So Grossman was actually an Army Ranger who became a psychologist. Along with some of his colleagues, Bruce Siddle and Mike Ashley, did a ton of research on how stress affects performance. And not surprisingly, what they found in the 90s and early 2000s matched up against some of the landmark work that was done many years earlier by guys like Petersen. And that a little bit of stress is probably good. You get a little bit excited, the heart rate comes up a little bit, and your performance peaks. And once you get beyond it, and you add additional stress, everything starts to deteriorate. You start to lose fine motor control. Your cognitive bandwidth begins to shrink. You start to forget things. And eventually you get to the point, as they refer to it, in zone black, all the way on the right side of the diagram here, where you're pulled up in the fetal position, peeing and pooping yourself, which is really suboptimal for what we do, I would say. But what was most interesting about the research that they did at this point in time was they were able to show that this peak level of performance, you could actually extend it. By teaching people different psychological skills and slowly exposing them to increasing levels of stress, what you could do was you can extend that peak performance. You can allow them to be in the zone, performing at their very best under greater levels of stress, which is really interesting. So, and this has been reproduced over and over and over again. Some of the most interesting stuff that I wanted to point out to you guys was done by NASA. Amazing research with astronauts that shows essentially the same stuff. So, how can we improve things? How can we actually improve our performance? Well, I believe that one of the things you can do teach people active, cognitive, and behavioral skills. That's kind of interesting. And it's all based on this very sort of ubiquitous concept that we call the cognitive triangle. In this milieu of neurotransmitters and nerves in your brain, all these things are kind of interconnected. Right? How you feel, what you think, and how you act, or your behavior, are all essentially tied together. And we can affect one corner of this triangle by dealing with or attacking the other corners of the triangle. So by affecting how you think, you can affect how you feel. And this has become essentially a cornerstone of psychiatric management of anxiety disorders, phobias, and a whole host of other things. So what I'm suggesting is, instead of using this to treat pathology, you use it prophylactically to prepare people to deal with the situation. So, what I want to take my experience, take the anecdotal evidence from other physicians and nurses and paramedics, and I want to overlay that with what evidence exists. And when you do that, what pops out is what I call performance-enhancing psychological skills. And the abbreviation I'm using is BTSF. Beat the stress rule. So it stands for breathe, talk, see, and focus. Ironically, shout out to Cliff Reed and Sydney Hems. It took an Australian to put together the Mr. T thing. I couldn't figure that out. But, nonetheless, thank you, Cliff. So let's go through this. Alright. So breathe. Really interesting. If you think about it, breathing is the only conscious control you have over what's otherwise an autonomic function. It's really hard to sit there and say, okay, blood pressure go down. Go down. Right? I mean, if it did, you wouldn't see like everybody and their mother on beta blockers and AC skippers. Heart rate maintained. But you can control your respiratory cycle. And there's evidence that suggests that by controlling this, you can mitigate other downstream effects of arousal and stress. So activation of the sympathetic nervous system, activation of the hypothalamic pituitary adrenal axis, that adrenaline rush that you get, you can actually mitigate those by using these breathing techniques. And as you'll see it in the literature, it's usually referred to as tactical breathing or box breathing or something along those lines. And essentially what it is just a controlled respiratory phase. Some people do it is take a deep breath of 4 seconds in, hold the breath in for 4 seconds, exhale for 4 seconds, and then hold it out for 4 seconds. So when you think about it, 16 seconds when you're excited is kind of a long respiratory phase. So whether your cycle is 3 seconds or 2 seconds or just taking a couple of deep breaths, I think you get very similar effects. So, talk. Positive self-talk. One of my favorite legends is actually an old Cherokee legend. And the way it goes is the grandfather is trying to explain to his son the conflict that exists in every person. And he says this conflict, a beautiful analogy, is essentially 2 wolves always fighting inside each person. And one wolf is hatred and fear and anxiety and jealousy, all the bad things. And the other wolf represents all the good things, happiness, joy, peace. And he goes on and on. Eventually the grandson asks him, he says, so how do you know which wolf wins? The grandfather looks at him and he says, the wolf that wins is the wolf that you feed. I think there's some truth in that. And actually, the literature kind of backs this up. Because if you look at people who go into a challenging event and question their ability, or they say like, oh man, I don't know if I can do it. It's been a while. They're like, oh my gosh, I've never tried somebody before. If you question your ability, people tend to become distracted and they perform much worse. But if you feed yourself sort of thoughts of affirmation, positive thoughts, reinforcing thoughts, I can do this. This person needs my help. I've trained to do this before. I can make this happen. I have to make this happen. This person's life is in my hands. Then those people do better. It maintains their focus and they perform consistently better. So by doing this, by feeding yourself these positive words, and I know it sounds a little bit silly. I thought it was completely ridiculous. I thought it sounded way too little engine that could. But it really bears it out in nature. By telling yourself this stuff, what's otherwise impossible might be possible. And what you're otherwise unable to do, suddenly you can actually knock it out. You and your well-trained team. Right? Last group, or almost, C, S, right? Visualize. Ever seen, watch the Olympics and seen, a swimmer on the starting blocks, or a diver, or someone, playing golf in the Masters? Ever watch someone actually sort of close their eyes and sort of go through the motions of what they're about to do? It's actually really, really powerful. So what I'm suggesting is, when you're going to set up to do an airway, actually getting all the equipment out, in your mind, use this powerful simulator that sits between your ears to actually run you through the steps of the intubation. Walk yourself through those steps. Because, as it turns out, when you run through it in your brain, it's essentially like giving yourself a practice run. If you look at fMRI scans of people who are actually thinking about an activity, very vividly walking themselves through the activity in their head, and compare it to people who are actually doing the activity, guess what? Essentially the same parts of the brain light up. That's amazing. So you're giving yourself a practice run right then and there before you actually go to intubate this person or put in the chest tube or whatever. So, what's more interesting is just recently, this past year, Chris Hicks and Lorello and their team actually they did a randomized control trial. They took surgical residents, anesthesia residents, and emergency medicine residents in Toronto. They taught them all essentially, trauma life support, ATLS course. And then what they did was they randomly assigned those residents to two groups. One group got about 30 minutes of CRM training, teamwork training, and review of trauma resuscitation. The other group was told to just sit there, close your eyes, and quietly rehearse in your mind how it's going to look when the patient comes through the door, how it's going to look when they transfer the patient over to their cot. What you're supposed to do based upon your position where you end up around the patient. And guess what? Surprisingly to a lot of people, the group that just did the mental practice consistently performed better, significantly. So that was kind of cool. Granted, a small, single-center trial, but not definitive, but I think it showed substantial promise and at least raised some interest in this area. And finally, focus. So focus is about using trigger words. Using a trigger word to transition you from this period of sort of preparation, of getting all your equipment together, to actually executing tasks. And that's important. Because this trigger, the trigger word, what that word does is it brings all of your mind's attention to bear on what you're doing. And as we just learned in the last lecture, your attention, the capacity of your attention span is really important. People who are distracted and not quite as focused on the task at hand, whether that be reviewing a patient chart, evaluating the patient, or actually performing a skill, people who are distracted perform consistently worse. The people who are able to focus and maintain that focus perform better. So, develop your trigger word and use that to transition you and bring your focus to bear on the task. So, ETSS, beat the stress through. There are some caveats and limitations that I want to mention. This has to be individualized. Okay? What stresses me out may not stress you out. I do a lot of neonates. You may be a neonatal transport specialist. So you have to figure out what triggers you, and you have to come up with your own positive self-talk, your own trigger word, whatever resonates with you. You still have to perform technical skills. You still do all of the training, absolutely. I'm not saying you have to do that. I'm not suggesting we sit around and sing Michael Roy or Blow Shore and imagine things in our head and then go out and then treat patients. Not saying that. All that other stuff is absolutely requisite. It has to be incorporated in practice. I use the term psychological skills for a reason. It's like any other skill. Airway skills, vascular access skills. You have to practice this stuff. You can't just expect to pull it out of your pocket in 6 months and hope it bails you out. It has to be incorporated into your practice regularly. And ultimately, when it becomes, like an Olympic athlete, when it's just habit. As soon as you open the back door of that ambulance, you're like, whoa, this is not going to be easy. This is go-go. This is going to be a while. You automatically sort of start taking a deep breath and fall into using the BTSS skills. And it hasn't been researched yet, at least this whole component. There's a lot of evidence to support all those pieces, which is why I'm drawing them together. But all four of them together, seeing in a randomized controlled fashion, if that will improve performance, hasn't been done yet. We're working on it. Actually, Chris Hicks at St. Mike's Hospital in Toronto, Canada, is right now setting up a randomized controlled trial to see if this will improve performance. And stress inoculation, I want to point out, is not just about stressing people out. It fundamentally incorporates these psychological skills. In other words, what we do is we teach people about stress response. We do a deep dive on the physiology of stress. Then we teach them, we go over BTSS stuff, and we teach them to develop their own skills. And they develop them practicing on mannequins and whatnot, individual skills like intubation, adjustment. And then we begin to slowly ramp it up in simulation, adding more and more stress, giving them the opportunity to practice these psychological skills. So I'm sure some of you still aren't sold, right? You're like, is this really worth it? Is this really worth our time? We're not killing people left and right. We want to play with real laryngoscopes and frightening people. That's what we want to practice. That's what we got to do. Okay, fair enough. And you might even add and say, well, this is really like a 1% thing. It's very, the number of patients that really carry the rest that we deal with that's probably kind of rare. 10%, 5% of our patient load. I'll give you even less. Say 1% or less. That's still good. In fact, about a year and a half ago, I gave a talk entitled Why 1% Matters. And what we did was we looked at natural systems, including human physiology. And it's very interesting because at the extremes of those natural systems, like when you're in Olympic competition, or like when you're at the edge of your compensatory capability when you're in shock, little things can make a big difference. And if we really, really, really want to provide superior pre-hospital care, if we want to be excellent, I say all those little things count. Up to and including using psychological skills. And I'll leave you with this last thought. If you take all the RCTs and the p-values and the confidence intervals, and you step all that to the side, what it comes down to at the end of the day is that realistic patient in front of you, right? And that might only be an N of 1. But I bet you that's a really important one to some people, like the person who's on the stretcher. Or their family. Someone's son, daughter, sister, brother, wife, husband, right? And when we have these patients that are really, really critically ill or injured, I think we owe it to them to be at our very best. Our technical skills, our mental skills, our psychological skills, everything needs to be brought to bear. Because sometimes every little bit helps, and every little bit counts. So, if you guys really like this stuff, please take BTSS home, try it out, see what works, let me know. If you like this human factor stuff, go to Imperturbability and check it out. I'll put up a post about, putting up a post at this point, every month or two as my academic schedule allows, and let me know what you think. If you guys think that I'm totally blowing smoke, go ahead, check out this QR code. This will take you to the list of references, 50 some odd references. That's the evidence to support what I'm suggesting here today. And if you don't have a QR code reader, just go ahead and email me, or tweet at me, or whatever. And I'm happy to send you all the references, all the slides, everything I've got. Thank you guys very much for coming.
Thank you so much for listening, EMSNation. We're excited that you continue to join us during EMS week, and we certainly appreciate your support and all the sharing that you're doing. This is a special EMS week for us, 2016. We're certainly hoping to get the podcast out to as many providers as possible, and really exploring whether we can make this podcast a vehicle for providers looking to not only advance their understanding of, cutting edge pre-hospital concepts, but also to potentially gain CE credits, CME credits for continuing medical education, regardless of which state you all are coming from. So if that's something that would interest you and you'd like us to push forward with that, we would love your feedback. Certainly leave a review on iTunes or tweet us at EMS EMS_Nation. EMS Nation, thank you so much for listening to the podcast, and thank you so much for dedicating yourself on a daily basis to go out there and provide incredibly high quality pre-hospital care, and to committing to be on a path of both personal improvement as well as systems-based performance enhancement. Now, we'd like to remind you we could really use your support. If you happen to have an Apple Watch, we'd love it for you to download the Perfect CPR app and use it during training, and let us know what feedback you have. At present, it's designed to give audio as well as haptic feedback during training cardiac arrest scenarios. And our hope is this can help improve outcomes both in the community and on a systems-wide basis to help decrease the disparity in outcomes in out-of-hospital cardiac arrest. Please tune in for the next episode of EMS Nation during EMS Week. This is Faizan Arshad, wishing everyone a safe tour.